Sexual pain in women is a topic that is often shrouded in silence, yet it affects millions of women worldwide. Understanding the causes behind this pain is an important step toward finding relief and reclaiming a healthy, enjoyable sex life. While sexual pain, known medically as dyspareunia, can be a complex and multifaceted issue, it is crucial to know that you are not alone and that help is available. Sexual pain can manifest in different ways. For some women, the discomfort is felt right at the entrance of the vagina, while for others, it might be a deep, internal pain during intercourse or even after. The pain may be sharp or burning, or it may present as a dull ache or feeling of soreness. It can happen every time or only occasionally. Understanding the nature of the pain, its timing, and its triggers can offer valuable clues about what's causing it. One of the most common causes of sexual pain in women is insufficient lubrication. Without enough natural moisture, friction during intercourse can lead to irritation and pain. Vaginal dryness can occur for a variety of reasons, including hormonal changes, particularly those related to menopause, breastfeeding, childbirth, or even certain medications like antihistamines, antidepressants, and birth control pills. Stress and anxiety can also play a role, as they can interfere with your body's natural arousal response. Another frequent culprit is infection or inflammation. Conditions such as yeast infections, bacterial vaginosis, or sexually transmitted infections can all cause pain, burning, or itching, making sex uncomfortable or even unbearable. In these cases, treating the underlying infection usually brings relief. Physical conditions affecting the vagina or pelvic region can also contribute to pain. For example, vaginitis, which is inflammation of the vaginal tissue, can result from allergies, irritants like soaps or douches, or imbalances in vaginal flora. Similarly, skin conditions such as lichen sclerosis or lichen planus can cause changes to the vulva, leading to pain and discomfort. Sometimes the cause lies deeper. Pelvic floor dysfunction is a common but often overlooked factor. The pelvic floor muscles support the uterus, bladder, and rectum, and if these muscles are too tight, too weak, or not coordinated properly, they can cause pain during penetration. Women who have experienced trauma, childbirth injuries, or chronic pelvic pain conditions may be at higher risk for pelvic floor dysfunction. Structural issues within the reproductive system can also be responsible. Endometriosis, a condition where tissue similar to the lining of the uterus grows outside the uterus, can lead to deep, aching pain during intercourse. Ovarian cysts, fibroids, or uterine prolapse can also create sensations of pressure or pain. Scar tissue from surgeries, such as a hysterectomy or episiotomy, can further complicate matters. Sometimes, sex-related pain is linked to specific events or trauma. Sexual abuse, negative early sexual experiences, or even past painful medical procedures can result in involuntary tightening of the vaginal muscles, a condition known as vaginismus. This involuntary response can make penetration extremely painful or even impossible. Psychological factors can be just as influential as physical ones. Anxiety, depression, relationship issues, or negative attitudes toward sex can all contribute to pain. When the mind is tense, the body often follows suit, making it harder to relax and enjoy intimacy. The cycle can become self-perpetuating. Anticipating pain leads to tension, which leads to more pain, which in turn increases anxiety. Hormonal shifts can also play a significant role, particularly during times of transition in a woman's life. The drop in estrogen during menopause leads to thinning and drying of the vaginal walls, a condition known as atrophic vaginitis. Breastfeeding and childbirth can cause hormonal changes that temporarily affect the vaginal tissues as well. For some women, allergic reactions or sensitivities to products like latex condoms, lubricants, spermicides, or even laundry detergents can lead to irritation and pain. Choosing hypoallergenic products and avoiding unnecessary chemicals can sometimes make a significant difference. It's also important to recognize that medical treatments or procedures can have side effects that result in sexual pain. Cancer treatments, particularly those for gynecological or breast cancers, often impact hormonal levels, vaginal tissues, and even nerve sensitivity, making sexual activity uncomfortable. In a surprising number of cases, no clear physical cause is identified. This does not mean the pain is imagined or less real. The mind and body are deeply interconnected, and persistent pain can develop even in the absence of obvious physical abnormalities. In these cases, approaches that address both physical and psychological factors are often the most effective. Addressing sexual pain starts with open communication, both with yourself and with your healthcare provider. Keeping a journal of when the pain occurs, its nature, and any associated symptoms can be helpful in making an accurate diagnosis. Don't be embarrassed to raise the topic with your doctor. Sexual health is a vital part of overall well-being. Treatment will depend on the underlying cause. For dryness, over-the-counter lubricants or vaginal moisturizers can provide relief. If hormonal changes are the culprit, prescription estrogen creams or tablets may be recommended. Infections or skin conditions require appropriate medications, while pelvic floor physical therapy can be beneficial for muscular issues. For women experiencing vaginismus or pain linked to psychological factors, counseling, sex therapy, or cognitive behavioral therapy can help break the cycle of pain and fear. Sometimes a combination of therapy, physical therapy, and medical treatment is the best approach. Relationship support can also be crucial. Open, honest conversations with your partner can reduce anxiety and help you both adapt to new ways of being intimate. Exploring non-penetrative forms of intimacy can maintain closeness while you work on resolving the pain. Sexual pain in women is common, but it is not normal, nor is it something you have to simply live with. By understanding the many potential causes, you empower yourself to seek solutions and advocate for your health. Reaching out for help, whether from a gynecologist, pelvic floor specialist, or mental health professional, is an act of self-care and courage. With the right support, relief is possible, and a fulfilling, pleasurable sex life can be within reach once again.